Hello friends, thank you so much for joining us for this episode of Life Over Coffee with Daniel Berger and Rick Thomas. Glad you're here. Thank you for your comments. As always, if you have a topic that you would like for us to cover, just put it in the comment section. It will get to us, and we would love to consider it, love to do a video for you if we can. One of the questions that does come up somewhat regularly on our forums is this idea of PANDAS. PANDAS is a real organic problem that people struggle with, and so I was talking to Daniel about it. He wanted to do a video about it, and so that's what we're going to talk about here. Daniel, PANDAS, start from the beginning. What is it?
Well, I guess I should preface and say and agree with you. I do think that this is a valid organic problem. We're seeing more and more children essentially who get strep, the Streptococcus infection, and it's a phenomena that is very difficult to explain, but it's a reality that this is an organic problem that many children are faced with. PANDAS is, I guess we should spell it out. It's a mouthful, but it's essentially a pediatric autoimmune neuropsychiatric disorders associated with strep or Streptococcus infections.
You could just say PANDAS if you wish.
Yeah. And basically what happens is the child gets strep, and there's almost like a personality change. They go from a loving, kind, caring child to being very anxious, and I use the word anxious as in they're clearly something's wrong. If you are drowning, you're going to be anxious, and rightfully so. So they're essentially just being honest that something is really wrong, and they're not sure, especially young children. So there's a clinginess to parents. There's a desire not to sleep by self, not even sleeping well, nightmares. It's very troubling.
They're afraid because something dynamically is going on inside of them.
Correct. So they don't necessarily know how to express it. I know when my children were younger, even nonverbal, but even when they were 2 years old, when they would get sick, they couldn't really express what was wrong or where they were hurting, but we knew they were sick. They had a fever, etc. Those are some of the most frustrating times as a parent, because you know something's wrong, but the child isn't able to communicate that. And so, again, we are talking about an organic disease. However, it's been interesting as I've interviewed numerous physicians. This is a very controversial diagnosis. And I'm not quite sure why it's so controversial. I mean, there's no denying that the child is suffering. There's no denying that there's a correlation between strep and the child's struggle with sleeping, etc. And I'll also add, I don't buy into the neuropsychiatric disorders. I mean, that whole label, it's a nervous problem. It's attacking, there's something in strep that's actually attacking the nervous system. So the whole psychiatric disorders shouldn't be there. It doesn't need to be there. I think it kind of confounds things. In fact, you'll see PANS as another abbreviation where it's talking about pediatric autoimmune neurological issues associated with strep. I think that's a better title. PANDAS sounds cuter, but there's really nothing cute about what these parents are going through. So some of these cases that I've dealt with, I mean, you've got children who they're sitting in church, and all of a sudden they just start panicking because something's going on in their body physically, and cold sweats. They have to get out of the room. They have to move. Many of the cases I've noticed that there's previous anxiety. So a child at school is being abused by other children. They're being bullied, I guess is a better word. And they don't really say anything about it. But then when they get sick, months later, all of a sudden that little problem that was a problem now becomes magnified. And now the child doesn't want to go to school because Johnny's going to pick on them, etc. So the anxiety issues become magnified. And of course, this happens with all of us when we're not getting sleep, which is one of the symptoms. When your nervous system is really going through a crisis, insomnia or sleep deprivation will increase a lot of these fears. It intensifies what we already struggle with.
So the anxiety is a response to an organic reality that is happening, but you're also saying that even past events that are totally not associated with
Correct.
the organic problem, and like the bullying, it was something that they could manage.
Right.
But now, because of this organic problem that's much bigger, more amplified, that they can even look back, now they can't handle that anymore.
Yeah.
In addition to this. Okay, that makes sense.
Yeah, and obviously we're seeing this more and more on the forum as well. A lot of people wondering about this, and I really, I encourage, if your child gets strep and you see a change in their behavior and their patterns of sleep and their personality, take them to the doctor and find a doctor who understands more. I'm no way an expert, but I've had to research it because we're seeing it more and more. In these kids, and they do, through antibiotics, there is a solution, getting it out of the system, but that the nervous system is directly affected in these cases. And of course, every child is different. So some kids will get strep and not be affected at all. Other kids, it seriously impairs. But a lot of what I've studied and what I believe, and this is just theory, because again, this has not been determined as I think it's a real organic disease, but there's people that say, well, we haven't found any biomarkers yet. But anyway, my theory is that a lot of this is related to not being able to sleep well. I mean, that the nervous system, again, begins to deteriorate, even the brain atrophying when people don't sleep well. I hope that helps, but the psychiatric disorders part, I think, is I don't even know who attached that, and that's more in recent time, but PANS is a better name than PANDAS.
Yeah, I think, so one of the questions is, which comes first, the chicken or the egg? And so anxiety and fear is our normal condition.
Right.
That's who we are as
Right.
people. And so we are always walking around as anxious people,
Right.
Fearful people. That's part of the Adamic package. Now, of course, Christ comes and we become a new creation. And so through progressive sanctification, our fear, we now fear not becomes, it's mitigated because of our growing faith in Christ. But because we have a predisposition to fear, like this is who we are, and then we have this organic problem, the question is, does this organic problem cause the anxiety?
Well, it's just like my grandmother passed away 2 years ago. Almost 3 years ago now, and she was 93 years old, and we talked quite a bit about the increase in anxiety that she had. This is common with elderly. Well, it's not an increase in anxiety, it's an awareness of, we're losing complete control of our life. And that's, as we've talked about, anxiety is that honest assessment that we're not the sovereign God. We're not in control. So when we begin to face death or struggle with disease, the right response is to become anxious. When you're drowning, a panic attack is what you should be having. And so we tend to look at panic as an abnormality, but there always is an explanation, whether it's physical or a mental or a combination of both. We're just being honest that we're not in control, and the response is what we call panic. It's, what do I need to do to get out of this? So I agree with you. The nervousness and anxiety are too often confounded, and we struggle with anxiety. That's who we are.
Yeah, and so the diagnosis would be twofold. I am panicking, I am anxious, regardless of what the situation is, whether it's PANDA or a cancer or just being old like I am and struggling with that. This is going to be amplified, but this didn't cause it, but this is just who we are. And so there's a spiritual counseling that happens here to address our fears, and then there's a physical, organic solution, for the PANDA problem. But you're saying that when we mix those, we can get into trouble.
Yeah, in one particular case that I had the privilege of helping the family, there was issues of anxiety that were previous to obtaining, getting strep. So it was something that once he began to heal and get better, we had to deal with. But like you said, there's often a dual aspect. So it kind of revealed an issue that he was struggling with that probably wouldn't have been revealed. Maybe it would have down the road, but it was good in that regard. But I just encourage parents, if you see a sudden change, don't just overlook that, especially if there's been strep. And that's true with I've seen reactions to antibodies. Some kids become actually very anxious with antibodies. So it's tough. We're in a broken world where we have to be very, very careful, but also considerate with physical and spiritual.
Yeah, and it's important to understand that's who we, just
all of us
as people, we are anxious, fearful. We intuitively know that we're not in control.
Right.
We're not in control.
We're not the sovereign God we want to be.
And when something comes, in this case, PANDAS is a physical, organic, biological thing. But when it comes, there probably is an expected reaction that there's going to be this anxiety, fear, worry, just complicating spiritual issues. And so it's just important to understand that regardless of what the thing is that we're focusing on, that we feel like we're losing control or can't manage. So we're talking about PANDAS. If you have any questions for Daniel or myself, please ask those. If you have any topics you want us to discuss, let us know. Thank you so much for watching.